We are extremely sorry for this technical glitch of us. I think we should begin the session. I'll introduce. Good afternoon, everyone. They say true teachers inspire not only through knowledge but through passion and dedication. Today, we are fortunate to have with us one such inspiring personality, our today's speaker, Dr. Madhu sir. He is distinguished scholar, clinician, and author in the field of Ayurveda, currently serving as a professor at Government Ayurvedic College, Kannur, Kerala, and pursuing his PhD at Kerala University of Health Sciences. He is widely recognized for his significant contributions to Ayurvedic academics, clinical practice, and scientific writing. He has delivered over 100 scientific presentations at national and international platforms, including the World Ayurvedic Congress, and has authored 17 books in multiple languages. His excellence has been recognized through several prestigious awards. A dedicated mentor and certified trainer, he continues to inspire students and professionals through his evidence based approach to Ayurveda. We are truly honored to have him with us today. I welcome you on behalf of organizing team, sir, and request you to please begin the session.
Am I audible?
Yes, sir, you're audible.
Can you see the slides?
Yes, sir, your screen is visible.
Is changing? Slide changing?
No, sir, slides are not changing. And sir, can you please make it full screen?
I will try.
Yes, sir, yes, it is visible now.
Is changing?
Yes, sir, it is changing.
Okay, okay. So let me start now.
Yes, sir, please.
Okay, okay. Then thank you very much for introducing, and let me convey my sincere regards to the organizers for giving me such an opportunity, great opportunity to share some of my views regarding spectrum of dermatological manifestations as per Ayurveda. The objective of our session is to study the morphological variations of different types of cutaneous manifestations described in Ayurveda, and some of the modern correlations also will be explored, and differential diagnosis criteria as per the principle of Ayurveda, and very important, Samprapti Vijnana. The difference in these cutaneous manifestations lies in the differences in Samprapti of these cutaneous manifestations. So, Samprapti Vijnana also very important, because we are treating the patients as per the Samprapti, and the objective of our diagnostic process is of Samprapti Ghadagas. So, as a whole, it is very, very important to assess the Samprapti and Samprapti Ghadaga of each and every cutaneous manifestation. So, as you know, different types of cutaneous manifestations are described in Ayurveda. From Jwara itself, we can see Udarta type of manifestations are explained in Kabhaja Jwara itself. Kushta, Visarpa, Shudra Roga, Shutra, Shidavitta, Udarda, Kodha, Utkodha, etc. are the cutaneous manifestations described in our syllabus. Other than these types of cutaneous manifestations, there are so many types, other types of cutaneous manifestations also are there. Example, Vadarekta, Uttana Vadarekta, etc. So basically, while we discuss about the cutaneous manifestations, we can see the concept of saptadravya along with the tridosha, Tokku, Lasika, Asarga, Amisham. Tokku, Lasika, Rekta, and Mamsa are the involved factors in certain types of skin diseases. For example, in Kushta, Visarpa, Shutra. In Kushta, Visarpa, and Shutra, we can see the involvement of Saptadravyas, while in Chudra Rogas and the Udarda manifestations, means Kodha, Utkodha, Udarda, etc., we can't see the involvement of Saptadravyas. So basically, the Saptadravya involvement means the chronicity. Chronic skin diseases will be having the Saptadravya involvement, and they are included under Kushta, Visarpa, and Shutra. Shutra is the hypopigmentary disorder. Though it is a hypopigmentary disorder, we can see the involvement of Saptadravyas. So, while discussing about Kushta, Vyadhihedu, Viruddha Ahara Viharas are explained. Pragobahedu, Mithya Ahara Viharas are explained. Mithya Acharas are explained. And along with that, we can see the Karma Hedu also, Karmaja Hedu. So, the Karmaja Hedu functions at the level of Srodho Vaigunya. Due to the Karmaja Hedu, as per Ayurvedic principle, some Srodho Vaigunya occurs at the level of Rasavaha, Rektavaha, or Mamsavaha Srodhasas. And due to Ahara Viharas, Amasanjaya, Doshagoba, Vadapragoba, etc. happens inside the Koshta, and that dislodged Doshadushti or Ama circulates all over the body, and that precipitates wherever the Srodho Vaigunya is there due to this Karmaja Hedu, especially in Kushta, Shutra, etc. And Pitta Sleshma Prakopa happens, which in turn vitiates Vada. Vada itself can get vitiated by Vada Pragopakara Aharas, and vitiated Vada takes them to through Tiryak Sira. I said Tiryak Gadaroga. Kushta is a Tiryak Gadaroga. See, the Dhadus vitiated means the disturbed Dhadus, Twak, Rekta, Mamsa, and Lasika. This vitiates the Dhadus. Dhadus get vitiated only after infliction by altered doshas, and they are conveyed through Bahyamarga all over the body. Dusha and the Sladhikritya means that particular Samprapti event is very, very important. Means the Grandhana or equilibrium of the Tokku, Lasika, Asarka, and Amisha. That is very, very important for the health of the skin. Health of the skin is maintained by the equilibrium of Tokku, Lasika, Asarka, and Amisha. That is a Grandhana process to keep equilibrium. Due to Ahara Viharas, there happens a Saladhana, Dosha and the Sladhikritya. That Sladhikritya means the equilibrium of the skin gets hampered by this Ahara Viharas. Such of the areas in which they are deposited, their patches develop on skin. Yatra yatra cha dosho vikshipto nischarandi tatra yatra mandalani pradurbhavati. Thus happens the etiopathogenesis of Kushta. Due to Ahara Viharas, Doshadushti or Rama Sanjaya may happen, and Srodho Vaigunya also may happen. At the same time, predisposing factor of Karmaja Hedu that already created some Srodho Vaigunya. Then Vikalpa of Dosha in Kushta is very, very important. 7 types of Mahakushta, Mahakushtas are explained, and 11 types of Shudra Kushtas are explained. Total 18 types of Kushtas are the for the academic purpose, only for academic purpose. There are innumerable stages and types of cutaneous manifestations in Kushta itself. In Kushta itself, there we can see different stages of this Vicharchika, different stages of Sitma, different stages of Dadru. So innumerable forms and innumerable morphological variations we can see. So innumerable varieties are there. For academic purpose, 7 types of Mahakushtas and 11 types of explained in Kushta Prakarana. While comparing with the modern view, also we can get hundreds of skin conditions that affect you. And while considering the Nidana Dosha Dushya Visheshebhyo, Nidana Dosha Dushya Visheshebhyo, that Vishesha, the involvement of Nidana, involvement of Dosha, involvement of Dushya in different proportions. That different proportions creates different types of skin manifestations. Specific features of Nidana, Dosha, Dushya determine the susceptibility to the manifestation of disease. So why we see different types of psoriasis? Gutted psoriasis is there, plaque psoriasis is there, scalp psoriasis is there. So depending upon the Nidana, Dosha and Dushya. Along with that, Srodhasas also should be considered. Depending upon the involvement of severity of Srodhasas, we have to assess that. In between, any difficulty in voice? Can you hear me clearly?
Yes, sir.
Sir,
Okay,
yes.
okay. Thank you. See, nacha kinjidasti kushtam egadosha prakopanimitam asti tu kalu samana prakrinavi kushtanam dosha amshamsha vigalpa anubandha sthana vibhagena vedana varna sthana prabhava nama chikilsita vishesha. Depending upon these criteria, the rationale behind the selection of medicines as well as treatment varies. Vedana, Varna, Samsthana, Prabhava, Vishesha are explained in each and every terminology. Under each and every terminology, we can see some particular types of Vedana, some particular types of Varna, Samsthana. Along with that, the involvement of Dosha Vishesha, involvement of the Gunas, Dosha Gunas are explained under the subheading of terminologies. See, though there is a general Nidana for Kushta, due to Dosha, Amshamsa Vigalpa and Sthana Vibhaga, there comes difference in Vedana, Varna, Agriti, Prabhava, Nama and Chikilsa of diseases. While going through the terminologies of Kushta, we have to assess the status of gunas, dosha gunas. Dosha gunas can involve in morphological variations, Vedana Vishesha, and the particular types of manifestations. Vedana Vishesha, for example, see, Vedana Vishesha, Kapalam, Toda Bahula is Vedana Vishesha. Varna Vishesha, we can see. Kaganandiga Varnam. Daugdika Pushpa Varnam. Like that Varna is explained. Samsthana Vishesha. Samsthana Vishesha, Rishajihwa Samsthanam. Rishajihwa. That is similar to the Jihwa of Sha. Like Prabhav Vishesha. Sadhyada, Asadhyada, etc. explained. And Nama Vishesha along with that. Kabala Ityadi. Means that especially in Kushta Prakarana, we can see the names. Names are given with the corresponding similes. With some types of pushpas are explained, some types of very, very familiar things are explained, like Rishajikwa, Gajacharma, Dautiga Pushpa, Durvavad Adasi Kusumachavi, like that. The very, very familiar during that period. These were very, very familiar for the people. See, single person may not take all the nidanas, and different nidana have different properties. It vitiates different attributes of dosha and dusha according to the vikalpa samprapti, resulting in manifestation of different types of kushta. So the question arises, why the morphological patterns are different, even though nidanas and samprapti is same. Nidana and samprapti, even though that seems generally same, the difference in dosha, dusha, and nidana varies, and according to the involvement of processes also, the morphological variations may be there. See, nidana seva resulting in dosha, dusha, dushti, vada, pitta, kapha, vada pitta, vada kapha, pitta kapha, and sarva dosha, resulting in amshamsa vikalpa of each dosha, exhibiting different features. So, for example, we can see dosha vikalpa lakshanas in kushta. See here, different gunas of doshas are involved in different types of kushta according to amshamsa kalpan. Here you can see Toksangoja, Swapa, Sweda, Spoda, Alshobha, Bheda, Kaunya, distortion of arms, and Sorobagada, etc. in Vada, means Vada dominance may manifest through these ways. Means while inspecting these types of morphological features, we have to assess the involvement of Vada in that particular clinical condition. Vaga, Avadarana, Anguli Padana, and Karnanasa Bhanga, Astiraga, Achiraga, appearance of purulent organisms, bacteria like organisms, purulent features, all indicate the dominance of Pitta. And Kandu, Varnabheda, Shobha, Srava, Gaurava, etc. indicates the involvement of Kapha. So, depending upon the symptomatic variations, symptoms and symptomatic variations, we have to assess the involvement of doshas in that condition. As per Ayurvedic principle, we are treating that condition to alleviate or to reverse that dosha dominance, and in order to select appropriate drugs to reverse the dosha dominance, it is very essential to assess the status of doshas in that condition. So, by assessing or by inspecting Kandu, by inspecting Shobha and Strava, by inspecting Varnabheda, we have to infer Anumana Pramana about the doshic involvement, and according to that, we have to select our treatments. See, as per Charaga, Vagbhada, and Susuda, 7 types of Mahakushtas are explained in classical textbooks. So, for academic purpose, we can see the involvement of doshas, and Samsarga is there, Sannivada is there, Egadosha is there. We have to compare. We have to compare these clinical features and the dosha involvement and their gunas also. 7 Mahakushtas and 11 Kshutrakushtas are there. Vikalpa samprapti of each types of kushtas. If we analyze the Vikalpa samprapti, dosha predominance, Kapala kushta, dosha predominance, Vade adhikatare, dosha vikalpa means Siruksha, Parusha, and Vedana Vishesha, Toda Bahula, and dark red in color, Varna Vishesha. Irregular in shape, Samsthana Vishesha. Prabha Vishesha Akritsram. The prognosis also can be included under Prabha Vishesha. That may be correlated. Actually, these all types of terminologies should not be correlated with one single condition. These terminologies should be compared with some stages of some particular skin diseases. Here, the Kabala Kushta features can be correlated with lupus vulgaris, most common Mycobacterium tuberculosis infection, painful cutaneous tuberculosis skin lesion with nodular appearance may be there. Most often around nose, eyes, lips, cheeks, ears, and neck, we can see nature of lesion begins as red nodules which enlarge form irregularly shaped red plaque. So certain lesions. Audumbara Kushta. In Audumbara Kushta, Pitta dominance is indicated. Doshavikalpa, Daha, Kandu, excluding large quantity of moisture, and Vedana Vishesha, Varna Vishesha, Samsthana Vishesha, Prabha Vishesha are explained in classical textbooks. We have to go through these features. Can be correlated with vasculitis purpura. See these types of Audumbara appearance. Dark erythematous clinical conditions. Mandala Kushta. Dosha predominance is Kabha, and Sthira, Sthana, and Snigdha are the dosha vikalpa. Due to the gunas of involved dosha, these features we can see. And white or red in color, Varna Vishesha. Patches matted with each other. Utsanna Mandala is Mandala Kushta. And Prabha Vishesha, Krithram. Here, that may be correlated with a certain types of fungal infections. All fungal infections we should not correlate with this mandala. Different types of this Tinea cruris is there, that can be correlated with Vrishna Kachu, while this Tinea versicolor or the pityriasis versicolor can be correlated with the Dadru Kushta, Durvavad. The spreading character of Dadru is like Durvavat. Like that, we have to correlate with that. Certain types of fungal infections which are having the circinate appearance, that particular morphological feature can be correlated with mandala. A skin disease caused by fungus. Actually, fungal infections are opportunistic infections. Whenever the fungus gets the opportunity to activate all over the body, then the fungal infection happens. Typically, it results in a red, itchy, scaly, circular rash. The border circinate reddish erythematous papular lesions will be there. Patches may be a redder or outside edges of resemble a ring. See, Rishajikwa Agridi Proctum. Rishajikwa Agridi. Dosha predominance is Vatapitta. The Vadapitta in Vadapitta Samsarga Vyati, Samsarga Kushta, only Rishajikwa is explained as a single entity. Vadapitta, Samsarga and Vadapitta involvements in Mahakushta. Dosha predominance, Dosha Vikalpa, Karkasha, Vedana Vishesha, Savedana, Varna Vishesha, resembles tongue of muscidi. Reddish discoloration will be there. Samsthana Vishesha, reddish border and dark discoloration center. Uneven surface will be there. And Prabha Vishesha, Vitrasadhya, prognosis. That may be correlated with the erythema multiforme. It's a skin immune reaction that develops in response to infection. Actually, this erythema multiforme is a secondary condition prior this post to certain infectious conditions like rheumatic fever. Bulging will be there. Rash like lesions that is red, pink, purple, or brown, usually circular and may run into each other. That is called Vishama. That borders are not symmetrical, or the borders are not regular. Surrounded by a zone of erythema. Rakta paryandam anda shyavam. Rakta paryandam anda shyavam. Pundariga Kushta. Pundariga Kushta, Pitta Sleshma, dosha predominance. Daha will be dominant as a result of this involvement of Pitta, and Varna Vishesha, pale discoloration, margined with reddish color. And in certain conditions, all the features like a Prabhava Vishesha may not be explained here. Samsthana Vishesha, Utsanna. May be correlated with the Tinea corporis, dermatophyte or fungal infection, annular lesion, raised Paryanda, Usseda, erythematous border and central clearing. Rakta Paryandam, Andasnigdam. Here, Sitma Kushta, Vadagabha dominance, Dosha dominance. Dosha Vigalpa, you see, Tanu, scales on rubbing, scales off on rubbing, and Ruja will be the white or coppery color. If afflicts mainly chest region, Samsthana Vishesh, and Akritsa. That can be correlated with the psoriasis vulgaris. It's a common clinical manifestation of psoriasis. Nature of lesion well demarcated, erythematous. Varna will be the raised plaque with white micaceous scale will be. Krishtam Rajakiriyad. Produce significant amount of scaling and remove scales produce pinpoint bleeding. Auspitz sign will be. And Kagana Kushta. Sarvadosha involvement is there, Kagana Kushta. And Apaga, Tivra Daha, Rukku will be there. And resembles Jequarity, dark reddish color. And Shudra Kushta, sir. Eka Kushta. Vadakabha involvements, Varna. Mahavastu resembles scales of fish. Eka Kushta actually it is exfoliative dermatitis. That will be manifestation all over the body and severe exfoliations from all over the body. That is Eka Kushta. And Charma Kushta is explained, dosha predominance is Vadakabha, and Samsthana Vishesha, skin over patch becomes thick like the skin of an elephant. Gajajarma. Roocham Kinagara Sparsha, Hidibam. Vadakabha dominant and blackish brown in color, rough in touch like scar tissue, hard to touch. Like that, you have to go through the various types of cutaneous manifestations explained in Kushta Prakarana terminologies. We have to arrange them under these criteria. Instead of studying only slogas, we have to understand them under these criteria. What is the dosha predominance? What will be the Samsthana Vishesha? What will be the Vedana Vishesha? Color, like that. We have to arrange them. Vibhadika, Vada Kapha involvement, and Vedana Vishesha, excruciating pain will be there. Panipada Dario Vibhadika. Panipada Dari Vibhadika. Cracks in soles and feet and palm. And Alasaya Kushta is explains Vada Kapha involvements, Kandu Ragayukta, redness, nodular lesions will be there. And the Dadrugushta. Pitta Sleshma involvements. See, while going through the textbooks, Brihatrais, you can see different dosha involvement in different terminology, under different terminologies, in different kushtas. For example, in Vicharchika, we can see involvement of Vada in Susruta Samhita. So, we have to understand that the dosha involvement in various types of kushtas are explained based on their own perceptions. Acharyas will be having their own perceptions, and based on their perceptions, based on their experience, based on their experience, they have treated different types of kushtas, and based upon their experiences, they might have treated them under those categories, under those dosha dominance categories. That may be the reason behind the classification, these types of classification. Kushta, Kandu Raga will be there, redness will be there, circular patch with elevated edges, and Charmadala Kushta with the Slashma involvement, Kandu Ruk, Sparsha, Asaha, redness, Spoda will be there, and the cracks in the skin will be there. And in Pama Kushta, Pitta Slashma involvement, Kandula, excessive itching will be there. Like that, we have to assess the Spoda Kushta. These are some exceptional variety classical textbook. And after descriptions about the Mahagushta and Shudragushta, the involvement of Dhadu Gatatwa is explained. Dushyas of Kushta are 7. Vada Pitta Kapha, Tuk. Actually, the Tuk should be considered as a structural entity of Rasadhatu. Structural entity of Rasadhatu. And Lesika also. Lesika contributes for the Rasa, and the Tuk and Lesika are to be considered as the different forms of Rasa itself. Rasa, Rakta and Mamsa. Basically, Rasa, Rakta and Mamsa are involved, and Lesika and Tuk can be the different forms of Rasa itself. Kushta that manifests over skin, if left untreated, shall subsequently involve further dhadus. Then the dhadu involvement. Toggada Kushta. While the samprapti of Kushta is more dominant at the level of Tokk. When the samprapti of Kushta is more, in Kushta samprapti, all the 7 dravyas are involved. Even though the 7 dravyas are involved, then also the samprapti khadagas can inflict certain levels dominantly. So in Toggada Kushta, these are the features: Parshahani, Vedana, Ishad Kandu, Vaivarnya, Toda, etc. are the lakshanas of Kushta at the level of Tok, when dominantly affected at the level of Tok. Rektagada Kushta. Tok Swabha will be there, Romaharsha, Kandu, Ibhuyaga, Shoyedhu are the features. Mamsagada Kushta. Bahulya, Vaktrashosha, Karkasha, Pidaga, Toda, Chiritva, Adhiga Klayada. These are the features of Mamsagada Kushta. Like that, the Dhadugata Kushta also should be considered. Then what is the importance? What is the relevance of knowing the Vikalpa of doshas? Dosha Vikalpa Samprapti. See, diagnostic use is there. Helps to predict the dosha combination predominant in a given variety of Kushta. Means that particular dosha guna should be assessed, and from that we can assess the involvement of doshas. From from the features of the morphological features of the lesion, we have to assess the gunas. Thus, we have to assess the dosha involved. In therapeutic aspects, helps to choose a specific drug which has the opposite quality to the involved guna for that particular kushta. Kushta visheshir dosha visheshai punascha kushtani charaga chilsa nyayande tair hedustamscha pragasheti. Knowing dosha vilva lakshanas, cause can be determined. In therapeutic application in mandala kushta, that's an example. As an example, see, dosha vigalpa lakshana of mandala kushta, due to the involvement of that particular doshas, sthira, sthana, and snigdha. Sthira, sthana, and snigdha. And the guna of dravya to be selected. What are the gunas? Tishna, ruksha, etc. should be selected. And dravya selected. For therapeutic use of mandala kushta, drugs usually selected are chitraga, nagara, palashakshara, gomutra, different ksharas. Even though the dosha vigalpa lakshanas can give us certain guidance about the dosha involvement, directly we won't use these types of medicines because in that particular samprapti, the involvement of ama may be there, involvement of other doshas may be there, and involvement of other samprapti may be there. So initially we will start the treatment by amabhajana aushadhas, sramsana aushadhas, in order to make the internal atmosphere suitable for the appropriate dosha antagonistic medicine. So initially we won't select dosha, the medicines that can reverse dosha only. That is the samprapti. That is the process of manifestation. So sanjaya, pragoba, prasara, sthana samsraya, all are essential for a manifestation. So basically, while a patient with mandala kushta comes, directly we won't select these types of therapies, but we will select a sramsana initially. After doing sramsana, paktavyam abhaktaiva srishtam koshte maladigam, that ama the prabhuda doshavastha should be eliminated, and after that we will give amavajana aushadas and devan aushadas. If necessary, we will give snehavana shuddhi, and after the initial process of shuddhi, the lesions remain, then we will select certain dosha against the medicines that can work against the dosha dominance. This is a general principle. Initially, we have already described about the examples, Shudrakushtas and Mahakushtas and their dosha involvement and assessment, diagnostic principles, and how we have to correlate these conditions with the modern clinical condition. And after the this Kushta rogas, we can go through the Kshudra rogas. Just trying to correlate these clinical conditions with some modern conditions. Ajagaliga is there. In Ajagaliga classical description in Ayurveda, we can see small, painless, mudga-sized eruptions in children. Papules and nodules, these are the morphological features, and that can be correlated with the molluscan contagiosum or milia. Yavaprakhya, actually, that can be correlated with verruca plana or callosity, and that is a keratic plaque papules itself. Some in certain patients we can see that keratitis. And a kachabiga is the raised lesions resembling tortoise shell, can be correlated with chronic plaque lesions, dermatofibroma lesions. And Patmini Gandaka, lotus thorn-like painful eruptions, like follicular papules, keratosis pilaris, lichen spinulosus, and Vidradhika is the small suppurative swellings, abscess or pharyngals can be correlated. And Masuriga, vesiculopustules can be correlated, mainly seen in chickenpox and smallpox like xanthum. Charmagila, wart or skin tag can be correlated. Tilagalaga is there, can be correlated with pigmented macules. And Necha can be correlated with nevus or congenital melanosis. Vyenga can be correlated with melasma, especially seen in menopausal ladies. And Neeliga is there. Pigmented patches can be correlated with us. Yatumani is there. And these are the Lajavarta, Mukhadushika, Patmagandaka, Vrishana Ina Kruris, Kendamala, Apaji, Anushai, Valmiga, all are the Shudra Rogas explained. Kadara, Podha, Chippa, Alasa, Udiga, Snai Grandi, all these are Shudra Rogas explained and can be correlated with some typical types of modern dermatological conditions. Shudra Rogas. These are the another group of lesions in dermatological spectrum. And Visarpa is a wide variety of skin manifestations, especially they can be correlated with so many other acute skin manifestations. The cardinal features of Visarpa are rapid extension, redness and inflammation, burning sensation, pain or itching, fever and systemic manifestations, vesicles, pustules, edema or necrosis depending on dosha predominance. Here in this session, I am not going to explain all these different types of Visarpa, and that can be correlated. The different types of Visarpas can be correlated with neuralgic inflammatory dermatosis, early ischemic cellulitis, herpes zoster with a severe neuralgia, erysipelas, acute cellulitis, severe bacterial skin infections, chronic cellulitis, lymphadematous inflammatory conditions, eczematous edema, necrotizing fasciitis, severe sepsis associated with skin infection, toxic inflammatory dermatosis, pemphigus, different types of pemphigus foliaceus and pemphigus vulgaris. Please go through the varieties of Visarpa. 3 types of Grandhi Visarpa. These Samsarga Visarpas are the Kardama Visarpa, Agni Visarpa, Grandhi Visarpa, and Egadosha Visarpas are explained, and Sannivadi Visarpa. Please go through the explanations of regarding the Visarpa and try to correlate with the modern clinical conditions, and the Samprapti Visheshas, the difference in Samprapti we can discuss. See, Vadades Trayo Dushtastom Giktam Mamso Ambucha, Tushiandi Sa Kushtanam Saptago Drivya Sangraha, Ada Kushtani Jayende Sapta Chaiga Dashaivacha, Nachaiga Doshajam Kinchit Kushtam Samupalabhide. That is the general statement regarding Kushta, involvement of Saptadrivya. Along with that, as per Susruta, Krimi also involved. Along with this Saptadrivya, involvement of Krimi also is there in Kushta. Here we can see Yadyapi Visarpanam Utpade Edanyeva Sapta Karanani Eduktam. Although in Visarpa, Saptadrivyas are involved, what is the difference? Rectum lesiga tongmamsam dushyam doshas trayomala Visarpana Sansputto Vitnyaya Saptadhadava. Iti. Tathabi Kushtam Chirakriyai Stirair Doshay Janyade Visarpastu Visarana Sheela Vishesha. That is Visarana Sheela. fast spreading character. Fast spreading character is the only Vishesha. Anyatu Visarpa, Vadadibiri, Egadesho, Abi, Bhavanditya, who dictum, Pratak Traya, Trivischego, Visarpa, Dandujas Traya. Here you can see Parisarpana Shabdartham Vyagarodi. You go through the Tippani of Visarpa. Parisarpo Athavetyadi, Parida Sarvadaha, Parishabdaha, Sarvade Sarvado Itya Arthe Ityartha, Kimva Parisarpana Shabdena, Sarpana Matramuchyade, Sarvada Shabdena, Parishabdartho Vyakriyate, Tenoktam, Sarvada Parisarpanai. Very fast spreading, very speedily that will spread all over the body. Acute exacerbations or acute spreading will be there. Here you see that explanation. The Tishna Ushna Gunas of Rekta. The difference in Kushta and Visarpa is that the Tishna Ushna Gunas of Rekta are mainly vitiated in Visarpa. That is why the Shikhra Visarpa Shila is. Rektam Lesiga Tongmamsam Dushyam Doshastrayo Mala, I explained. Adeva Vividham Sarpadi Yado Visarpastena Sanjita Ityuktam Tatha Vishishta Shonida Dustivashadeva. Vishishta Shonida Dustivashadeva Visarpo Prabala Vedana Bhavadi. The clinical manifestations explained in Visarpa is due to the Vishishta Shonida Dustivashad. That is why, while explaining the treatment of Visarpa, we can see Rektamoksha. Rektamoksha. Rektakledad hi jayade. Visarpa is created due to Rektakleda, due to the vitiated kledatva in Rekta. So, in order to alleviate, in order to discharge out the aggravated kleda of Rekta, we have to do Rektamoksha in Visarpa. So, Egadastani, Sarvani, Rektamokshanam Egada. Here, in Shutra, you can see different types of Shutra are explained. Dharanam, Charanam, Shutram, Kilasam, Namapistribi, Vinyam, Trividham, Tacha, the Dosham, Prayashicha, the Doshe, Rektaside, Rektam, Tamram, Mamsamaside, Shvedam, Medaside, Shutram, Guru, Tachottarottaram, Yatha Parasparado Bhinnam, Bahu, Rektalomavad, Echa, Vashaganayovanam, Tachitram, Neva Siddhi, that Sadhya Sadhya also explained. The involvement of dosha in different types of Shutra are explained. Here, while in Kushta, different levels are explained and Visarpa Rekta Pradhanyatam explained. In Shutra, Toggadameva. Even though the involvement of Saptadravyas are there, the involvement of Tok is dominant. The relevance of Tok involvement is very, very important as far as Shitra is concerned. Toggadameva Kilasam. Ituktam Tacha na Kushtavad Rektadigata Kushtalakshana Karagam Shutram Ityabhi Apiprayena Oktam. Ihatu Yad Rektadhyasaitum Shutrasya Uchyade Tad Rektadi Doshamatra Apiprayena na Rektadi Gadam Samasta Kushtalakshana Garidaya. Then Atrabi Tongmatra Vigridigaragatum Shutrasya Sammadamevedi Navirodha. Even though Saptadrivyas are involved, the manifestation is only at the level of Tok. The dominant involvement of dosha at the level of Tok is the reason behind the Chitra. But you have to understand the involvement of Saptadrivyas in that condition also. That is why the Sambhurna Shodhana After proper Snehabana, after proper Snehabana, you have to perform Vamana or Virajana, and all other treatments mentioned for Kushta should be performed for Shutra also, because that is not only skin deep. Not only skin deep, but Saptatrivya involvement is there. We have to purify the body initially. And as you know, the hypopigmentary disorder is happening due to the melanotoxicity. The melanotoxicity causes the destruction of melanocytes. So that melanocytes can't be regenerated, and DOPA negative melanocytes around that region can be stimulated to recolorize that area. For that, we have to address the system. We have to address the system by purifying internally. Internal purification can be performed by the Panchakarma procedures, and after Panchakarma procedures, the treatment that can trigger the DOPA negative melanocytes can be utilized in that case. Wherever DOPA negative melanocytes are not there, for example, lips and tips. On lips and tips, we can't find the DOPA negative melanocytes. That is very, very difficult to regenerate that DOPA negative melanocytes around that area. So they are considered as asadhya. Agni Dagdaja also. Agni Dagdaja Pandu. Not Pandu, Shutra. Agni Dagdaja Shutra can't be regenerated, because in Agni Dagda, the melanocytes gets Dagda. So that can't be regenerated. Along with that, in Shutra, the explanation regarding the Shutra, dosha karma kshayad kshayam. Dosha karma kshayad kshayam. Karmaja hedu is there. That karmaja hedu, actually that karmaja hedu is the basic reason behind the hypopigmentation, Srodo Vaigunya at that level. Tokkada, Srodo Vaigunya will be there in those patients with vitiligo or leukoderma. So the manifestation happens means the Srodo Vaigunya is there. So Srodo Vaigunya can be addressed with the dosha and karma treatments. Devobhasraya Chikitsa and Panchakarma Shuddhi Chikitsa, Shodhana Chikitsa. Along with the Shodhana Chikitsa, the Devobhasraya Chikitsa also should be incorporated while treating Shutras. And Shida Vitta also. Cutaneous manifestation, the other variety is Shida Vitta. Urticarial manifestation, urticarial variety. So many types of urticarial lesions are there. In urticaria, the involvement of saptadrivyas are not there. In urticaria, involvement of saptadrivyas are not there, and you have to consider the Rasagada Ama in all Shidavittas. Rasagada Ama. Actually, Rasagada Ama should be assessed by the evanescent character of Shidhavitta. Under the category of urticarial manifestations, we can see Shidhavitta, Udarda, Kodha, and Utkodha. 4 varieties of skin manifestations are explained under the category of urticarial character in Ayurveda. Atha Shitavitta Udarda Kodha Nidana. While explaining the Shitavitta Udarda Kodha Nidana in Madhavidana, Shita Marda Samspashad, Pradushto Kapamarudo, Pittena Sahasampuya, Bahirandar Visarpada. Manifestation, symptom, Varadi Dashtasatana, Shodha Sanjaya de Bahi, Sagandu Toda Bahula Chardi, Jura Vidahavan. In Shitavitta, Udarda and Kodha, the Nidanas are explained. Shitamarida Sansprashad, Pradushto Kapamarudo. Pittena Sahasampuya. Actually, these triggering factors, these are triggering factors. Shita only Shita cannot create an urticaria. Whenever exposed to Shita a person in whom the ama Sanchayavastha is there, or Rasagata ama is there, Rasalina ama is there. Person who is having a Rasalina ama, whenever he gets exposed to certain Shitamarida Sanskricha, then Varadi Dashta Santana Chotha Sanjayate Bhuhi. Varadi Dashta Santana means that pain, severe pain will be there in certain types of urticaria. Sagandu, Todavahula, along with that, Chardi also will be Chardi, Jara, Vidahavan. Then only we have to diagnose them as Shitavitta. Nowadays, in our clinics, we diagnose all types of urticaria as Shitavitta. That is not true. That is not correct. In Shitavitta, Varadi Dashta Samstana, a painful urticaria should be diagnosed as Shitavitta. Sagandu Todabahul, Chardi Jwara Vidahavan. Obviously, Chardi and Jwara may not be presented in certain conditions. Patient may feel nausea and a subjective feeling of increased temperature. Other than that, there may not be Jwara and Chardi. Udardamidi tam vidyad Shitavittam atha apare. Vadadigam Shitavittam Udartattu Kabhadiga. That is the basic difference between Shitavitta and Udarta. Shitavitta is a Vadadiga and Udarta is Kabhadiga. And Sotsangaischa Saragaischa Kandumadbhischa Mandalehi Shaishira Kabajo Vyadhi Udarda idi Kirtida. Sotsangaischa, that is a feature of Udarda. Kapha dominant Udarda. So Utsangaischa Saragaischa Kandumadbhischa Mandalehi Shaishira Kabajo Vyadhi Udarda idi Kirtida. And the reason see Kodha reason for the Kodha. In certain conditions we can see, if we suppress Vamana, if we suppress the nausea, Asamyat Vamanodirna Pittasleshma Anna Nigrehehi Mandalani Sagandoni Ragavanti Bahuricha Utkodha Sanuvandascha Kodha Ityabidiyade. Utkodha Sanuvandascha Kodha Ityabidiyade. Patients, whenever they explain the history of intake of certain food items and nausea to that particular food item, and after that, if they feel certain skin rashes all over the body, that can be correlated with Utkodha. Asamyaktvam Vamanasya Ayoga Mithya Yogadina Tathodirnanam Pittasleshma Annanam Nigraho Vega Vidharanam Tair Mandalani Jayade Sa Kodha Adhava Ayamartha. Asamyak Vamanodirno Pittasleshmano Tatha Anna Nigraha Ubastida Vegasya Annasya Nigraha Chardi Nigraha Diyavat. If patient feel nausea after taking certain food items and he suppresses that feeling, and after that, after further he develops the skin rashes all over the body, that should be considered under this. Vamanasya cha samyaktvam Ayogam Mithyayoga Abhyam Nyayam Adiyogasya tu Pittasleshma Kodhagaratwad Edena Hedulakshana Veda Vinnaha Kodha Udardad Kodho Nirenivantha Tatha Choktam. Treniga Utpada Vinasha, evanescent character. Treniga Utpada Vinasha. Manifestation will subside within a few minutes. Kodha idi nigadyade tatnyai. Idi sanubantha utkodho abhidiyade. Along with the articarial manifestations, if there is having certain accompanying features, anubantha, And along with the accompanying features, if the recurrence, cha anubandhata cha punar bhavanena, utkoda. Koda is a simple urticarial rash which aggravates and subsides within 1 or 2 minutes or hours, and that will not appear again and again. But utkodha is having a characteristics of anubandhatva. Anubandha means anubandhata cha puna bhavanena, recurrence again and again, that will reappear. पित्तश्लेष्म कोठागारत्वादि एतेन हेतुलक्षणभेदा भिन्न कोठ उदर्दात् कोढो निरनुबन्ध तथा च उक्तं क्षणिक उत्पादविनाश कोढ इति निगद्यते तज्ञ इति सानुबन्ध उत्कोढो अभिधीयते सानुबन्धता च पुनर्भवनेन. Differences. What are the differences? Shitapitta and Udarda share the same pathology, but Shitapitta is Vada predominant and Udarda is Kapha predominant. And Kodha differs from Udarda because it has a distinct etiology: improper Vamana, suppression of Arjas, aggravated Pitta Kapha, and lesions are short-lived and evanescent. Utkodha is essentially recurrent Kodha. The commentator explains Sanubandha as punar-bhavana, repeated recurrence. Thus, recurrent wheals correspond more closely to chronic or relapsing urticaria. And morphological correlations. Shitapitta, Varadi Dashta Samsthana, actually that can be correlated with the wheel. Udarda, urticarial plague. Kodha, Raghavanta Mantala, evanescent wheel. And Utkodha, recurrent chronic urticaria. See comparative table of Shitapitta, Udarda, Kodha and Utkodha. And primary cause features, primary cause, dosha predominance, morphology, color, pruritus, and pain should be compared in all these conditions. And swelling, associated features, duration of lesion, recurrence, classical distinguishing features, possible modern correlation, all should be compared with each other. So, in short, we have gone through different spectrum of skin manifestations like Kushta, Visarpa, Kshudraroga, Shitra, and Shitapitta, Udarda, Kodha, Utkodha. So in these skin manifestations, while comparing the Samprapti, the Saptadravya involvement is there in Kushta and Visarpa and Shitra. In Kushta, the Saptadravya involvement is very chronic, and involvement at the different levels causes different types of manifestations. While in Visarpa, the Tishna Guna, Ushna Guna properties of Rekta is more dominant, and that is why the Visarpa Swabhava is dominant. In Shitra, the involvement at the level of Twak is relevant. At the same time, in Shitapitta, Udarda, Kodha, and Utkodha, the involvement of Dosha Dushti at the level of Rasadhat, Rasalinatva, Rasalina Swabhava of Dosha Dushti or Ama plays an important role in manifestation. That is why, while treating the Shitapitta group, spectrum of urticaria is very easy to cure. We can digest the Ama at the level of Rasa with Rasa Pajana Kashayas. But the other clinical conditions, other cutaneous manifestations, where the involvement of other factors are there, should be considered seriously, and proper Snehavana Shuddhi, proper Panchakarma becomes essential in those cases. So, while comparing or diagnosing all these skin manifestations, you have to be very, very cautious about these samprapti ghatakas. In short, while inspecting the cutaneous manifestations, or all external manifestations should be considered as a tip of an iceberg. Tip of an iceberg. The huge etiopathogenesis happened inside the body. Inside the body should be inferred. Should be inferred means by Anumana Pramana, you have to assess the involvement of doshas, dushyas, srodasas, agni and all to reverse that particular clinical condition by assessing the samprapti ghatakas. So let me conclude here, and once again let me convey my sincere regards to the organizers for giving me such an opportunity to share some of my views regarding the spectrum of skin manifestations. Thank you very much.
Thank you so much, sir. If there are any queries, please ask. You can also put into the chat section. Also, the link for attendance form is in the chat section. Please fill the attendance form. Okay, no queries? Okay, we shall proceed. It is my pleasure to introduce the co-chairperson for today's session, Dr. Savita Wale ma'am, an accomplished academician and researcher in the field of Rognidan. She is currently serving as assistant professor and head of the Department of Rognidan at Vasantdada Patil Ayurvedic Medical College, Sangli, Maharashtra. She is presently pursuing her PhD from Tilak Ayurved Mahavidyalaya, Pune. With over 7 years of teaching experience, she has made commendable contributions in academics and research. She has been honored with the Best Researcher in Ayurveda Award and the prestigious Rashtrapati Puraskar undersigned by Dr. APJ Abdul Kalam. Her dedication to the research is reflected through multiple paper and poster presentations at national and international seminars, several award-winning achievements, and publications in reputed journals. Her work in Satvavajay Chikitsa for neurological disorders, particularly anxiety and migraine, is truly noteworthy. We are honored to have her as the co-chairperson for today's session. Ma'am, I request you to please share your valuable insights.
Thank you. Thank you for a nice introduction. Respected our esteemed resource person, Dr. Madhu sir, respected faculty members, postgraduate scholars, and all the participants present today, good evening to everyone. It is indeed a great privilege and honor for me to serve as the co-chairperson for this academic session. I would like to express my sincere gratitude to Dr. Santosh Giribide sir and Jyoti ma'am, organizers for their dedicated efforts in conducting such an enriching academic programs that foster knowledge and sharing academic excellence among Ayurveda scholars and practitioners. In today's world, where skin disorders are becoming increasingly prevalent and many chronic conditions continue to challenge conventional treatment approaches, Ayurveda is emerging as a hope for patients seeking holistic and lasting relief. In this regard, today's session was truly enlightening. The practical insights and clinical wisdoms shared by Dr. Madhu sir transformed classical concepts into meaningful clinical understanding, making it valuable learning experience for all of us, especially postgraduate scholars. I extend my heartfelt appreciation to our esteemed resource person, Dr. Madhu sir, for delivering a highly informative, scholarly, and clinically relevant lecture on the topic spectrum of dermatological manifestations of Kushta and allied conditions. One of the most remarkable aspects of the today's lecture was the systemic explanation of the diverse morphological variations of Kushta, their modern dermatological correlations, differential diagnosis, and the underlying principles of Samprapti Vijnana. Sir explained various cutaneous manifestations described in Ayurveda and correlated them with present-day dermatological understanding, making the subject easier to comprehend and apply in clinical settings. The detailed discussion on the involvement of Saptadravyas in Kushta and Visarpa was particularly enlightening by Dr. Madhu sir. And sir has explained the role of Tvaka Rakta Mans Lasika along with the contribution of Vat Pitta Kapha doshas in the manifestation, progression, and clinical presentation of these disorders. Sir also highlighted the Samprapti of Kushta should not be viewed solely through the lens of Saptadravyas. Other important factors, including Krumi, and associated Samprapti Ghatakas must also be considered to achieve a complete understanding of the disease process. This holistic understanding is fundamental for accurate diagnosis and effective management according to Ayurvedic principles. The session also provided valuable insights into the various causative factors of Kushta, including Vyadhi Hetu, Prakopak Hetu, Karmaj Hetu, and the explanation of these etiological factors help us appreciate the multidimensional etiological factors and nature of the disease process and reinforce the Ayurvedic concept of the individualized disease manifestation. Another important learning point was the explanation regarding the classification of different Kushta, Shudra Kushta, through although the Kushta possesses innumerable variations, the Acharyas have classified it primarily for academic understanding and clinical convenience. And Sir beautifully explained and elaborated how these varieties can be understood based on different stages of disease, Vedana, Varna, Sanstana, Prabhava, and the predominance of dosha and dusha involvement. This perspective enables us to understand the disease spectrum in a more logical and comprehensive manner. Another noteworthy aspect of today's lecture was the excellent use of illustrative diagrams and clinical representations to explain the various types of Kushta. Sir simplified the complex concepts by systematically displaying the morphological features, dosh dusha involvement, and disease progression through well-designed diagrams. These visual explanation greatly enhanced our understanding and helped bridge the gap between theoretical knowledge and clinical application. So, on behalf of all participants, I once again express my sincere gratitude to Dr. Madhu sir for sharing his vast knowledge, clinical experience, and scholarly insights. So, finally, stay curious, keep learning, and continue contributing to the advance of Ayurveda. Thank you.
Thank you so much, ma'am. Due to some inevitable work of his, our chairperson could not attend this session today. So, with this, we come to the end of today's enlightening session. We sincerely thank our respected speaker for sharing such valuable knowledge and our co-chairperson for her gracious presence and guidance. Also, there's an announcement to make that tomorrow's session is been postponed to day after tomorrow, that is Saturday. The other details will be updated on the WhatsApp group soon. Thank you. I officially declare that the session is concluded. You can leave the meeting.